Thank you very much, Mr. Maya. Hello, I'm very pleased to be joining you and very pleased that Secretary of State Maria Manuel Letal Marquez invited me to share with you the experiences that we've been exploring at the Accenture Institute for Public Service Value on front office shared services. I'm leaning on the slides. All right. The Accenture Institute for Public Service Value is a body created by Accenture to explore high performance in government around the world. It is not an internal research and development organization. It is meant to investigate high performance in government and share what we learn with those who actually deliver those services to citizens. We conduct research on a wide range of issues. Some of it is listed here. All of it is available to anybody on our website, which is listed here. And so the research I described today is free for you to look at and explore. But today what I will be talking to you about is front office shared services in line with the theme of this conference. But before doing that, I want to explain briefly why it is that we looked at front office shared services. Accenture has a distinctive definition of high performance in government. It is not defined by efficiency or effectiveness alone, although those are important measures. It is defined by the improvements in the social and economic conditions which your agencies provide for citizens. So high-performing health organizations are those that improve health, not just get a lot of patients through hospital. High-performing education organizations are those that help their students achieve places in higher learning or in employment, and not simply get high test results. This idea is conceptualized in the concept of public value, the improved economic and social conditions of citizens. And in the course of our research, we decided that who better to ask about what that value should be than citizens themselves. So for the past 3 years, we have been conducting studies around the world to ask citizens what they think government should be doing to improve the social and economic conditions within which they live. Those studies were conducted in cities from London to Rio de Janeiro over the last 3 years. The studies involved citizens in day-long deliberative events in which they debated with each other what it is that they thought government should do for them. We put citizens into very distinctive roles: the role of taxpayer, the role of service user, and the role of member of the wider community. We had them develop views related to those roles, and then we had them debate. We did not participate, we listened, we learned. And what we learned is that what citizens around the world want are key principles to guide public service delivery and government performance, the most important of which is equality and fairness. Citizens in every city, in each of the 17 cities that I identified first equality and fairness as the principle which they believe should guide your performance. Transparency and accountability was also very important, and what I've done here is listed the top 9 of the principles that citizens in those 17 countries around the world identified. They are different in different cities. This is a very complicated graph, perhaps, but it shows each of the 17 cities and each of the 9 principles. What was impressive to us, beyond their talking about equality and fairness, transparency and accountability, and customer focus and flexibility, which is largely about the information they get, is that they were also concerned about how you work. They want you in government agencies to be more connected, more coordinated, more integrated in the way in which you provide services to citizens and in the way in which you meet their needs. And it was with that message from citizens that we said we should begin taking a look at how it is that government agencies connect. Now, there's been a lot of work over the past few years looking at shared services in government generally, mostly back office, payroll, human resources, etc. What we wanted to take a look at was front office. We wanted to take a look at that point at which services are delivered to citizens and investigate what it is that agencies are doing to join up, work together to improve people's lives by linking one service to another. Because what we learned was that people expect government agencies to respond to their needs in a holistic, joined-up manner. So that was the rationale behind the Shared Office Front Services study. We began by defining front office shared services as any initiative in which two or more agencies work together. These would be government agencies for the most part, but we also looked at collaborations with the private and the not-for-profit sector. And we undertook this research by taking a look at the reasons that agencies are moving in this direction. Clearly, the current financial constraints are making government agencies think more carefully about how they move forward in creating efficiencies and effectiveness for citizens. But citizens, too, are demanding this, as our research in the global cities showed. The improvement and efficiencies that we are making in the silos of government, in the individual agencies, of course, are important, but they are not enough. And what we wanted to take a look at is how agencies cut across the approaches, cut across facilities, cut across silos to deliver more effective as well as more efficient service to citizens. We believe that if we could learn about what it is that high-performing government agencies do, we could find some models, some lessons about how you could develop more effective responses to needs, how you could provide seamless service to citizens, how you could achieve efficiencies and reduce your own costs, but how you could also reduce the cost to citizens to be served, so that citizens did not have to go to 4 or 5 different agencies on 6 or 7 different days to obtain the service they needed, but were able to reduce the effort and reduce the time and reduce the expense that they had to put in to the service transaction. Our research was based on case studies in these countries and with these agencies around the world. We did look at Poupa Tempo in Brazil. We looked also at the citizen shops here, but we looked at New York City's Health and Human Services Connect. We looked at the local government and national government work around pensions that's being done in the UK, and we looked at work in Canada, New Zealand, and Norway as well. These were intensive case studies in which we interviewed executives who had been responsible for making the integration happen. We also interviewed recipients, citizens, and professionals who were involved. What we found is that there are essentially 4 ways in which government agencies are trying to create integration around front office service delivery. The first of those ways is by developing collaborative information and assessment systems. So basic sharing of information. A second and more advanced step is to develop what we've called collaborative customer interface. That is bringing together agencies to create greater and easier access to multiple service transactions for citizens. An advanced step to that we call network delivery, where agencies began using case management and agreed protocol to work together, probably on much more complex needs than simple transactions like licensing, more around issues like employment or welfare. That sort of network delivery enabled agencies to orchestrate the way in which they provided services jointly to citizens. And the fourth and most integrated step was what we call joint delivery. I'm going to go through each of these briefly now. The presentation that I have will be available on the AMA site. and there's more detail than I'm going to read or talk to you about if you want to go through it. But I'm just going to go quickly through the four because I want to come to what are the key difficulties that Mr. Maya talked about in his introductory remarks that government agencies are facing as they try to move up this path of integration. The collaborative information system allows multiple agencies to work together. It enables citizens to provide information only one time. It is a good way of beginning to share information across different agencies and particularly across different professional groups. And that's a very important issue to which I will return. To enable a relatively low level of integration, but to enable the citizens to see that what they are telling one agency, another agency knows and can use that information to better serve them. Perhaps the best example we saw of that was Health and Human Services Connect in New York City, which connects 42 health and human services agencies across the city in one information base. They've developed a virtual integrated case file that holds all information on the client that all agencies can see, but the client can see as well. As I've said, information is only given once. Data is analyzed to help different agencies reassess what it is that they have to do in order to better serve citizens from their vantage. And in this early stage, what people in New York are seeing is getting on the path to a much greater integration. They start at this very low level, at what we've called the information and assessment sharing level, but their ambition is to go higher. And I'll come back to why it is that they're doing that when I talk about the problems and difficulties that get in the way. The second level is the collaborative customer interface, in which two or more agencies share the apparatus for government interaction. This enables citizens to access multiple services, and it usually involves and can involve the development of web portals, telephone information, etc., which allows citizens very easy access to a multiple and a wide range of services. It is a relatively low level of integration, but it is very good for citizens in terms of minimizing the cost and effort that they have to expend in order to access a wide range of services. The two best that we've seen in this regard were the Time Saver Centers in Sao Paulo, which provides a single point access for citizens around a range of applications like licenses, Social Security, medical exams even in some of the centers, and where trained customer advisors assist citizens in making applications where they need it. I was impressed in taking a look at the Popotempo centers and learning that the processing time for Social Security numbers, for example, is now 24 hours compared to the 2 or 3 months that it was previously, because of the way in which citizens could come in, provide information right away, talk to the people who are providing that information, and resolve issues immediately. And of course, the second, which I was very pleased to be able to visit yesterday, is your own citizen shops. I won't tell you about these, you know about these, except to say I'm really, really impressed by the second generation move to allow citizens to come in and tell you what their problems are. I lost my wallet. I need a job. Rather than try to find out what services you provide. That's an impressive way of focusing on outcomes, of focusing on what citizens were demanding in terms of holistic delivery. And I'm not saying this because I'm here. I had a dream of this place because we had written about it a year ago, and I went to it in downtown yesterday, and I didn't imagine 3 stories with kids waiting and playing on computers while their parents are dealing with driving licenses, and it was very, very impressive. You're to be congratulated.